this. All right, good afternoon, everyone. Welcome to the Tempe City Council work study session for Thursday, August 12th. The time is now 4:30. Due to concerns over COVID-19 exposure, the city has implemented measures to protect our community, including the closing of council chambers and limiting public attendance to electronic means only. Members of the public may view the live meeting proceedings on Tempe Channel 11 or attend the meeting virtually through Cisco WebEx events by visiting tempe.gov/clerk for more information. The first item on the agenda is the call to the audience for issue review session items. Speakers have up to 3 minutes to address the City Council. Madam Clerk, were there any comment or speaker cards received from the public?
No public input for today on any item, Mayor.
All right, thank you so much. I'll go ahead and close the public hearing then and move on to item number 2, which is item 2A, COVID-19 update, Tempe's vaccination campaign. And I'll go ahead and call up staff. I believe it is Rosa Chowsky, our Deputy City Manager, as well as our Fire Chief, Greg Reese.
Yes, thank you, Mayor. Good afternoon, Mayor and members of the City Council. As Mayor introduced me, Rosa Chowsky, Deputy City Manager. And with us today, we also have Tempe Fire Medical Rescue Fire Chief Greg Reese. And I'm going to go through a few slides, and then Greg's going to join me towards the end to talk about some of the initiatives and the strategies that we have planned for our community to hopefully address what is occurring with the Delta variant. In months past, we knew when the vaccine became available that we wanted to be proactive as a city. So we worked, created a think tank with the county and our partners at Tempe Fire Medical Rescue to identify some specific Tempe-centric metrics that would help the community understand dashboards and decisions being made within our cities. As you see here, we'll start with the wastewater, COVID-19 wastewater testing that is unique to Tempe, and we're very proud of this program because it helps inform as an additional data point in making decisions. As you can see, obviously the COVID levels have started to climb a little bit, and actually the genome copies, as we have now learned this past week, are still actually lower than we had 4 weeks ago. So we are checking that trend data, and we are anxiously waiting to see what happens in the next week. As you know, that is all based on trend data since we have no other city to compare that to. Next slide. The second metrics that we look at is the COVID-19 cases per 100,000 by zip code. And these are specifically the slides, this slide and the next slide is tracking through the county. So these thresholds have been established by the county. As you can see, unfortunately, all 4 zip codes on the left are in the high category as far as transmission. Next slide. Also, the third metrics we look at is the COVID-19 % positives by zip code. And this is one of those things you hear about the news. We actually, 4 weeks ago, we were in 6% positivity rate in one of our zip codes, and now we're at 15. I never like to just share bad news. Obviously, you can see that it's high, but since Friday when we created this PowerPoint for all of you, we are now in 85284 reduced down to the substantial or the moderate. So we are actually trending, at least in one of the zip codes, in the right direction. This also may be due to the vaccination rates in 85284 are actually one of the lead zip codes for vaccinations in our city. Regarding those zip codes, if I may just share also, it's hard to see on the map that you see or the dashboard, but if you hover on the live side of covid19.tempe.gov, you will see that all 4 zip codes have ticked down, or with the exception of 85284 has obviously changed from one screen to another as far as transmittability or the COVID test positives, but the other 3 are actually trending in just slightly lower. Another unique metrics that we have in Tempe, the slide right before that, was our EMS calls for service. Thanks to Dan Petty and our Tempe Fire Medical Rescue Department, we are able to upload the COVID-related calls, probable calls for service in Tempe. And also, it's one of the things that we track regarding what are we seeing as far as severity of the virus. Last week, we had 14 calls for service, and this week so far, we have 7. So once again, it's looking at that trend along with other data points. The next screenshot that you will see it looks like an eye test, but it's not, and I'm not going to go through all these details, but it's just to show you some of the data that we look at on a regular basis. And what you see here is thanks to Stephanie Dietrich, working with the county, updated COVID-19 vaccines by zip codes. And we highlight the age group because specifically we know that there's disproportionate vaccination rates with age groups. Specifically 15 to 24 and 45 to 54 are the toughest to move into that vaccination. So we are also looking at the zip codes by age group, and 85283 and 84 are the highest vaccination rates among all age groups and categories. Next slide. We also look at the race, and we know that Hispanics are the lagging demographic regarding vaccinations in our city, specifically also in 85281. Next slide. As far as gender, we don't see anything too disproportionately different. 85281, close to even between male and female. Male has the lowest rate in 85282 and 83, and then 85282, it's also very much like 81. It's very close in demographics as far as vaccination rates. This is the slide that we all follow very closely. As we know, vaccination rates help accomplish herd immunity, which is really, as the CDC says, it is the best defense and the strategy to getting us back to normalcy and our active lives and not having to witness what we're seeing right now in our community and across the nation, which the variant is affecting. Overall, for eligibility of all those who are eligible in Tempe, we have about 57% of our community that is vaccinated with first dose. Fully vaccinated is at 51%. But when you compare that to the county, fully vaccinated is 45% and one dose is 54. So we're still trending higher than the county, but it's nowhere where we would like to be. As a county, Dr. Rebecca Sonnenschein says we really want to get to at least 70% for that herd immunity. The good news, as I always like to share, between August 6th and August 11th, and looking at the data specifically, we've had almost 900 vaccinations. That's in 5 days. And when you look from the beginning of March, that is really a substantial increase in vaccination and people using or getting the vaccine in the city of Tempe. That is very good news for us. So the next slide, as you know, with strategic planning, we are a very data-driven organization. We set goals all the time. So the team decided we needed to set a goal that we follow, that we strategize, and also that we implore and call to action our community to join us in trying to get to the 75% by Labor Day. The specific Labor Day is because we know that our school-age children are back, and the importance of the vaccine and the herd immunity or vaccinations is really now affecting those 12 and under who are not eligible for a vaccine. So when we started talking as a group as far as how we message or what we wanted to do as far as strategies, we always start with, as I mentioned, data and looking at specifically what is our community, our Tempe-centric community saying about vaccinations. So we wouldn't just implore all resources everywhere, but we really would hone into the messaging on the specific age group demographic of what we needed. So we contracted with Zen City, which actually you are familiar with. They conduct our monthly sentiment survey with Tempe Police Department, asking about the police trust score. So in the next slide, you will see the survey overall took place in July. So now we have the information and it gives you highlights. I won't get into the details because I want to share the highlights of the survey, what your community is saying about vaccination hesitation. Next slide. So one of the questions specifically you will see as far as vaccination plans, the takeaway with this is unfortunately that more than half of the respondents said they don't plan to get vaccinated. As you can see, that is 54%. I always say there's an opportunity in every crisis. So the opportunity is with the 10% who haven't decided, and you add the 22% who are waiting for safe and effective results, or at least perhaps the FDA recommendations, or perhaps information from our local officials as far as the safety of the vaccine. And then obviously the 9% that said they plan to get vaccinated. So that total is a 41%. The next slide. So looking at vaccine concerns, how big of a factor are they in shaping opinions about getting the COVID-19 vaccine? So for those who are unvaccinated, the opportunities are in the following statements, which they ask us to address high-risk concerns and offer vaccination clinics on days that people take off, like in the evenings, on the weekends. People don't want to miss work, and they don't want to miss it based on feeling sick afterwards. So a little more flexibility in the accessibility of that. And interesting enough, also, if you will see, 21% said registration and administration of the appointments or pre-registering for appointments were a concern. I think perhaps it is some of the distrust people have with what happens after with that information. Next slide. So in asking about the value of the vaccine, what was the most important reason that people who are vaccinated got the vaccine? So we learned from those who did decide. So more importantly, the lessons learned from this question was, of those who were vaccinated, protecting self and others is the highest. That did not surprise me and others on our task force. And we looked at it and we said, what we know about our branding in Tempe and what we've learned about what people say is we're a technological hub. We are innovative, but we also are a very compassionate, caring community. So that was a gem to see that, because I think that is part of the messaging, that caring validation of how we want to message vaccinations. Next slide. The value of that vaccine. Before vaccinating, were you concerned about the vaccine? And what we wanted to know is, we know that people have some hesitation. What is the optimal group that we are able to move from the middle to getting vaccinated? So we see that of those who were vaccinated, 29% said that they were concerned and still got the vaccine. So it basically validates that people don't feel 100%, or at least most do not feel 100% about getting the vaccine, but that's okay. And that is where our Tempe Fire Medical Rescue, our county, and our other healthcare officials in our community can help step in to help people feel more comfortable. This is also an opportunity to have the myth busting as far as some concerns that we hear from the youth regarding infertility and other concerns. There's also a Wordle they did as far as what are people identifying as the value of the vaccine. Once again, affirmed to protect myself and my family and friends. It was required by an employer, or an employer is thinking about requiring it, or a doctor or healthcare provider recommended the vaccine. Next slide. The value of the vaccine, what would encourage you to get vaccinated? And as we can see, the strongest drivers are avoiding long-term effects from the COVID-19 virus, was the most frequent response that we heard from people, and the reason to get vaccinated. And also protecting others and getting back to regular activities, enjoying life again to its fullest, are the best three drivers. Next slide. And then the source of influence, high level of trust in healthcare officials nationally and locally in Tempe. That is not true in every city across the nation. So it was nice to see that people are saying, it's more than nice, actually. It is affirming that we have done a great job of building trust with our community locally, and also that we've either translated enough information from the CDC and the county that helps them feel informed about decisions. That is why our strategies moving forward will involve, obviously, our Tempe Fire Medical Rescue, the CDC information, ADHS, county, and also our local community partners like Mountain Park. Next slide. So actions about accessibility. This is one of those things that people always talk about. Well, why don't people get the vaccine if it's around the corner at every Walgreens, CVS, Safeway, every market, grocery store? And there is a reason for that. I think people define accessibility much differently than others. And I think if we want to see an increase of vaccination, we need to meet people where they are. And Tempe's very good at that historically. So we understand that accessibility means meeting people locally in neighborhoods, perhaps seeking folks in the community that are influencers, making it easier to vaccine at night or on the weekends. And related to accessibility is perhaps in the neighborhood hubs, markets that they already frequent or patron. Next slide. So one of the things we wanted to know before investing a lot of money in incentives, and we wanted to find out whether it would be a motivator for people. Do we want to invest in gift cards, airline tickets, lotteries, as we have seen in other states? And actually, this was hopefully, this was very informative, because before we did that, we got the answer that only 1 in 4 said that they would be motivated by an incentive. Although I was really surprised to see gas cards as one of the second that vaccinated people would like, but said that they would like. But overall, 1 in 4 unvaccinated respondents reported that incentives would only increase their likelihood to vaccines. Those aren't very good odds. Next slide. Specifically, we identified through data that we did have in our metrics is that we knew that students, that age group, early 20s, early 30s, zip code 85281, and Hispanic demographics of our community were the ones lagging as far as vaccination or feeling comfortable to get vaccinated. So we asked Zen City to ask specific questions regarding those demographics to understand and help us message better in understanding what their concerns are. Next slide. So students specifically said that are concerned about the safety, 40%, as compared to 22% in Tempe said that they are concerned about safety. So students disproportionately are more concerned about the safety of the vaccine. The good news on this, and we shared with our ASU partners, is they trust ASU for that information regarding health. So obviously they know that they are surrounded by people who help them understand, and they are a trusted source. They also would like the vaccine on nights and weekends so they don't miss work. Next slide. And now we look at 85281. 60% said no intentions to vaccinate. This was very hard to see. But we will still work at this, because obviously this is one of those areas that we know has high poverty in our city, and we have to address and meet people and keep working at it. We don't give up in Tempe. So specifically looking at registration and administration, we need to address why are people concerned about registration and administration? What about that documentation? And our Tempe Fire Medical Rescue is looking at more details as far as what information regarding IDs and what people need to provide. Obviously, nights and weekend, once again, is an action that we keep hearing over and over in the data. And then lastly, the last group that we identified that helped understand a little bit more is the Hispanic, and that's the next slide. Thanks. Was the 60% or higher said that they were resistant about getting the vaccine and they would like it on nights and weekends. High trust in local agency. And this was a little different than others, because others said that they trusted CDC or other agencies like ASU, obviously. But this is very specific to say they trust their local health agencies. That is a huge opportunity for us with our Tempe Fire Medical Rescue, Mountain Park, and our other healthcare clinics locally to partner, because that, once again, that is not true of all cities in this nation. Next slide. We also created a focus group with our MIAC, Mayor's Youth Advisory Commission, who helped us identify perhaps some recommendations for strategies, and you will see them there. And we will work with them moving forward with strategies and helping, hopefully having them use some of their TikToks and other social media platforms to help us get the word out as far as myth busting, as far as what we call myth busting on issues that people are concerned about with the vaccine. And then the next slide, last but not least, stakeholder strategy sessions that we've been having. As you can see there, I don't need to call them all out by name, but I just want to say that in true Tempe fashion, we have met internally with our city departments and our local stakeholders, and they have been very informative as far as helping us brainstorm and bring what you see before you as far as strategy recommendations. Once again, I have to thank community services. So this was created on Friday, but since then, Keith Burke has already offered to have 2 employees help with our vaccination hesitation and push for the next month. So I really appreciate just the internal working groups and the relationships of people trying to do what's best for public health for our community. So I appreciate that. And once again, the data IT and Dan Petty from Fire Medical Rescue, who have helped us with so much data. Every day we're asking for different data points to help us understand what we need to do. So I really appreciate the internal working group. And I think at this point, I would like, our chief also wanted to mention some folks he'd like to thank specifically, and then we'll get into the neighborhood vaccination events.
Thank you, Rosa. Thank you very much for that. And Mr. Mayor, members of council, I had a conversation with Rosa over the last few days as this presentation was being developed, and I thought it would be a good opportunity before we share with you some of the things that are proposed moving forward. I'd first like to, if you would give me a second to reflect on the things that have been done, and Rosa did no doubt thank the partners we have, but we could not have done what we've done over the last year plus if it wasn't not only for our internal support we get from each and every department. Phone call, that's all I've made, and it's just been unbelievable when Rosa and I have come up with what we think are ideas or things that we can do to better serve the community and combat this pandemic. So I'm going to run through a few of those things real quick, and please bear with me. But again, if I don't capture you by name, I do want to recognize a few people. But if I don't capture you by name, every single department has assisted us, and from the city attorney's office, Mr. Mayor, you and council, as well as city manager, deputy city managers, and I could go on, as Keith Burke was mentioned, community services, human services. We've had so many RPIOs. I could just keep going. Again, thank you very much for your support when we pick up the phone. Looking back, here's some of the work we've done, and we still have a lot of work ahead, but this is an opportunity to really thank you all for the work we've done. We've accomplished some great things together. Essential workforce, phase 1B, where we vaccinated almost 500 of our employees, received all 12 doses over 12 different dates. Quite the accomplishment. And if not for the trust that the medical services section here at Tempe Fire Medical Rescue built with the county, I don't know how we could have received those 500 doses. And they are still, through the leadership of Nick Ells, able to call the county, and when we think we have a clinic we can run, they are able to get the vaccine for us for those clinics. We assisted with medical standby at Maricopa County vaccination pods in Chandler and Gilbert early on. Our workforce was there, and we stood by to assist them with the pods. We did medical standby at the vaccination events within the city of Tempe. We had 12 different events we did standby at, including the school vaccination events and Juneteenth. Vaccinations for the vulnerable populations, which we did at Escalante Center. Again, we didn't do that alone. Our partners in the city helped us, as well as our partners in the county. Escalante Center, TCAA, great partners. We get together and we put a plan together. There are so many people that have played a role in this, and I can't name you all, so I'll try to not hurt anybody's feelings by throwing too many names out there. COVID-19 saliva testing. What a brainstorming idea this was. Rosa again led this along with Kim Fields at ASU. We all met and we thought there was a chance we could host this. Again, with our city partners in ASU, we conducted 4,600 saliva tests at the Cahill Center every Tuesday for a period of time, at least till we saw the numbers going down. Obviously, a big thank you to our partners at Maricopa County Department of Public Health for the around-the-clock support. The relationships that our medical services have built with them, they truly are a phone call away. Katie Turnbow, for all the up-to-date information that you provide and ensuring we have the vaccines to administer at our own pods. Epidemiologist Dr. Rebecca Sonnenschein, she's been mentioned here. Wow, what a support system she has been for us in the city, and they jump on phone calls with us as busy as they are. They see the things that we're doing here in Tempe, and they're always jumping on the phone with us and brainstorming and supporting us. Dan Petty, around the clock data collection, along with IT's group and the stuff they're doing. And again, if I did not thank Chief Nick Ells, always a phone call away from me, and Chief Glass and Chief Duty for the reports they've done over the last year, the Facebook Live updates for our community. I can't thank them enough. And all of our FMR members and all of our city employees. It's been a very challenging year and we still got some work ahead. But before we move forward, I just want to thank you all. And I just want to do a quick couple seconds or maybe minutes of reflecting on where we've been before where we're going. So thank you.
Thanks,
Next,
Chief.
Next,
Yeah.
Nick.
Yeah, next slide. Thanks, Greg.
Absolutely.
I was going to ask Rosa, if it's okay, Councilmember Adams, did you want to speak now or wait till the end of the presentation?
Till the end of the presentation.
Okay, sounds good. Great. Thank you so much, Rosa. You keep going.
Okay, I think we probably both have a little say here since we had the opportunity this week. Rosa reached out to Dr. Joe, is what he likes to be called, Dr. Gerald, Dr. Joe, at U of A, and his team took the time out of their busy schedule this week and met with us, that is teleconference with Rosa, her team, as well as some fire medical rescue. And moving forward, we want to continue to offer vaccination clinics, and we're working with the county on that. And up here, you can see some proposed sites that we have. But what we learned from them is the success they're finding in making testing available again. Testing is, as obviously the numbers are up and the desire of our community members to be tested for peace of mind, there's an opportunity they're finding that if people are tested, they may even reconsider or consider getting the vaccine at that site. So moving forward, we're taking their advice, and we're not only going to provide, obviously we've did the separate pods and the clinics in the past, we're going to combine them moving forward, and we're going to give our community members the opportunity, we hope, to be tested and vaccinated at the same site. Rosa?
Thank you, Chief. So as the Chief said, we had identified that we're going to meet people where they are. We're going to go into the heart and the nucleus of these neighborhoods and identify influencers and our community partners that we have spent so many years building with, and ask them to be shoulder to shoulder with us trying to get to our goal of vaccination. So as the Chief says, we had these strategies identified, but when we met with Dr. Joe Gerald and his team, they specifically identified that in Maryvale, they were conducting vaccination clinics, but the greatest success is when you couple that vaccination clinic with testing. So thanks to the Chief and his team, Nick Ells and others, Daryl Duty, they have been able to identify doing that specifically for our community. And that is what we're going to be hitting hard in the next 3 weeks, is offering both those things. So as people wait for the rapid test results, 15 minutes, if they have questions about the vaccine, we are able to educate and share with them all our answers. But it's an opportunity to have a conversation and a dialogue. You will see there a lot of things I don't need to reiterate, but it's basically everything from food pantries to homeless communities on Tuesday that we will launch, and basically going out there and offering testing and COVID. Those two strategies are still the best way to get at this virus and the Delta. Next slide shares with you what the chief has said as far as the communication and outreach. Nikki and her team have been tremendous creating the outreach with our community. And now we know that we need to build on that and accelerate those conversations and those strategies with our community to get to our goal. And really, in the end goal is to protect our kids. Those are the folks that we really need to start thinking about here. And last slide is the vaccination action plan. As you know, strategies is what we focus on, and then pivoting if those strategies aren't working, looking at something else. So we will be keeping count of how many vaccines in our community, but focusing on 85281, emphasizing the localized neighborhood approach, what Tempe does so well, concentrating communication and messaging in both languages, English and Spanish, since we know is needed. Focus on neighborhood influencers, your HOA presidents, thanks to Shauna Ward, they're gonna work with us in helping identify specific people. Equity in Action will also be an equal partner on this. Scheduling after workday and close to home vaccination events, pairing vaccination events, as the chief has said, with the existing events. Park after dark, thanks to Cape Borders, we've already identified a day that we will be on Mill Avenue, and hopefully work with our business community to help us amplify the message. Anything else, Chief, that we need to mention?
The last piece, one question's been asked, and again, this is not confirmed yet. We're working with our partners at county. What would we be administering? It will be a single dose vaccine, just because being able to get the second dose, so it's extremely easy for somebody to get the single dose. So that's actually what we're working on, and I'm sorry I didn't say that earlier, Rosa.
Thanks, Chief. With that, I will turn it over to the mayor.
Great. Thank you very much to Deputy City Manager Inchausti and Chief Reese for the presentation. Really appreciate it. I'm going to first go to Councilmember Adams.
Thank you, Mr. Mayor. I just want to thank our fire and police chief. I know the police also helped with the vaccinations for the city vaccinations, our city employees. So I want to say thank you to them. I also want to thank the Deputy City Manager, Rosa Inchausti, for all of her help and leading these efforts and the close partnerships that she's established with others in our community that have been very needed for improving our vaccinations and all of the outreach. Nikki's team for the outreach, and I'm really glad that we're going to continue to do that, and that they're in charge of the communication outreach. And also, I really like the plan that we are going out to the community. I think it's so valuable to bring it to them and make sure that people have every single opportunity to get vaccinated possible. So it's just so exciting to see, and we're so innovative in our city, and I'm so proud of our accomplishments with this deadly disease. And let's get people vaccinated. Please get vaccinated and save lives. So thank you. That's all I have, Mr. Mayor.
Thank you, Councilmember Adams. Really appreciate it. Any of the council members, any comments or questions?
Hi, Mayor. This is Doreen.
Yes, Councilmember Garland.
Rosa, I think the information that you gave was wonderful. I think what was really striking to me was the intentions slide, and then the values and concerns. I think being able to gather that information so that we could look at that and really move forward with that and try to make adjustments in the plan that we have moving forward, I think is so incredibly important. So I really think the value of the information and the data is exactly what you do best at, what you are best at, and I'm glad that we were able to do that. I like the idea of combining the COVID testing along with the vaccinations. I think that was very smart. I think that's going to work out really well. And I think if you have people there that are looking or are listening to information about getting the vaccinations while they're waiting for their COVID test, I think that's the greatest time to grab them. I love that we're going to be reaching out to other communities and going into those communities I love that you're reaching out to the, using the Neighborhood Advisory Commission to be able to help you with that, grabbing those neighborhood leaders. I think that is so important, and it's exactly what the city of Tempe is about, is we wrap our arms around those people who need it most and we go to them. And I think this is wonderful. You guys have done a great job, and I'm so excited about seeing what we're going to be doing and hoping these numbers will go down with these testing. So thank you so much, Chief Reese. Thank you, Rosa. Thank you for everybody.
Wonderful. Thank you, Councilmember Garland. Next, I'm going to go to Councilmember Arredondo Savage.
Well, Doreen just said everything, so I'm not really sure what's left to say. Thanks a lot, Doreen. But, you know, I too just want to also comment how amazed I am when I read this presentation and just how thoughtful and how so much collaboration that is happening and going on. And there's nobody better that reminds us about strategies, action, and outcomes. And Rosa, that is you. And you have really, you know, put us, you know, in a really great position to do so many incredible things. And your work with Chief Reese and Tempe Fire Medical Rescue has just been phenomenal. And I have an opportunity to talk to some of my other counterparts in different cities, and we're crushing it. And we're crushing it because people care, and people are actually being proactive and doing the right things. And to have our other departments step up and say they're going to help, like with Keith Burke and what he's doing in our neighborhoods, and having people help and to be there and not making it just one department carry the heavy load. And that is what Tempe is all about, just like what Doreen mentioned. And, you know, I am forever proud and grateful for the work that you all continue to do, and for this organization, and to going out to our neighborhoods and identifying where we need to be and the gaps we need to fill. And I have the utmost faith that we will continue to increase our vaccination rates, and we are going to see significant gains and be a leader, like I think we always are in a lot of things. So thank you, Rosa and Chief, for everything that you do, and for all the team, for everybody really stepping up. It means a lot, and it's noticed, definitely all across the state. Thank you, Mayor.
Thank you.
Thank you, Councilmember Arredondo Savage. Next up, I'm going to go to Councilmember Navarro.
Yeah, quickly, Mayor, because it's all been said. I just wanted, I think Councilmember Donald just mentioned this. You have no idea how impressive this city is when it comes to coordination, cooperation, and doing the smartest, right thing, and making our decisions, and how sound and thoughtful we are. I so appreciate it. That's all I'm going to say. I so appreciate it, because when you work for two cities, you really get an understanding. And I tell you what, it's outstanding how we're doing it. So thank you.
Great. Thank you, Councilmember Navarro. Let me next go to Vice Mayor Keating.
Thank you, Mayor. Thank you, Rosa, for that great presentation. And thank you, Chief Reese, for all you've done for the community and getting everybody vaccinated. One of the frustrations I found while encouraging people to get vaccinated is, you know, vaccination hesitancy due to all kinds of different myths. And I can't even tell you some of the stuff I've heard of why they're not going to get vaccinated. So I wonder if there's an opportunity, and I know you're going into communities, I know we're doing outreach, to specifically target these myths. And like maybe there's like a one sheet we can create that says, you know what, the vaccine will make me infertile. Well, actually, it won't. And here's a supporting link that will tell you exactly why. So I do think that people tend to trust the government that's closest to them. And right now we're getting our marching orders from the CDC, which of course is part of the federal government based in Atlanta, but no one really knows that. So I don't know if it makes sense for Tempe to kind of try to like proactively fight the myths, either on our website or through handouts in English and Spanish, that we're going door to door and we're going into these communities. But I'd like to see something around that, because a lot of folks just have made up their mind. And when I talk to them, they're like, oh yeah, well, you know, I'll do my research and let you know. And it's like, but you're really not doing your research, because if you were doing your research, you wouldn't believe that it will turn you into Jeff Goldblum from The Fly. So you know, I'd like to see some sort of larger plan around, you know, combating vaccine hesitancy as far as the conspiracy theories and the myths go. Another thing that, and this might just be something for me and Robin to discuss, or excuse me and Councilmember Arredondo Savage to discuss. It just kind of popped in my head, like, what if we do some sort of voluntary, you know, business recognition, like we do with equal pay? They, you know, they earn equal pay status and they get like a sticker to put in their window. Maybe there's something we can do there with our businesses to say this is a vaccinated business. That might make some, you know, Tempeans feel more comfortable about frequenting that business if they're concerned about the Delta variant or, transmitting COVID to others or being exposed to COVID at all. So, I mean, that's something that maybe our committee can kick around a little bit this month, but those are just some ideas that popped into my head. But I think the number one concern that I have is breaking through this wall of misinformation. And I think, again, I think the government closest to the people is probably the most trusted. So we might have a unique opportunity to do that. Just some thoughts. Other than that, I mean, this is a great presentation. Obviously, the city's been very well managed in our vaccine efforts, thanks to your efforts and others. So I'm very pleased with where the direction Tempe is moving in.
Thank you.
Excellent. Thank you, Vice Mayor Keating. Rosa, I believe you might have one other slide you wanted to show.
Yeah, just because we know that people are watching, Mayor Molina from the town of Guadalupe has been a partner with the wastewater, and we keep in close conversations, and she just wanted to make sure to share with the council and our Tempe residents, and we can put up that slide. Thank you. Vaccination, the tribe Pascuayaki is offering $100 if you prove that you have been vaccinated. And obviously these are the vaccination sites for the town of Guadalupe, but they also wanted to make sure that people know that there's that opportunity. And we have Tempe residents that do qualify as being members of the Pascuayaki tribe. So once again, we are looking and gathering as much information from not just our city, but our neighboring cities as far as anything that helps our community get to vaccination rates. Thank you, Mayor.
Thank you. I just want to say really quickly to Deputy City Manager Chowsty and Chief Reese, just thank you again for an exceptional presentation. I definitely won't, belabor it. As Councilmember Navarro said, I mean, everyone has said such incredible things about the innovative work that's being done here at the city. And we all know the city is in very, very good hands from a management standpoint, just in general, but obviously management of a once-in-a-lifetime pandemic between the COVID wastewater tracking, the vaccination rates, the tracking of emergency medical transport call. I mean, you covered everything in that last half hour that I think any question that a person could absolutely have about any of this. And I also agree, with Vice Mayor Keating talking about, whatever we can do also moving forward to really kind of go headfirst against some of the myths and the falsehoods surrounding vaccines. Because like Vice Mayor Keating, I've heard a lot of them too. And I just sort of, I'm going, I kind of sometimes want to roll my eyes, but then I realize like this person's actually serious. They really believe this. And so if we're going to really, hit that, 75% number that we're talking about, I do think that probably doing whatever we can to dispel some of those rumors and myths and falsehoods would be definitely a good thing. But quite honestly, I'm just blown away by the presentation, as every other member of council talked about. I just wanted to thank you for all of your hard work as always. I also wanted to make sure before we stopped, I go back to Councilmember Adams one other time. So Councilmember Adams.
Thank you so much. I also agree with Vice Mayor Keating's ideas. And I also would add that maybe we could do a mailer to our entire community about the myths and try to counter those, and also reach out to our neighborhood advisory commission to help with the communication around the neighborhoods and things, and try to partner with them and get everybody together working as a group. So thank you, Mr. Mayor. I have purple on also tonight. I like your purple handkerchief.
Thank you, Councilmember Adams. I appreciate it. Great minds think alike.
That's right.
Let's see. Rosa, Chief, anything else?
Chief, anything?
Hey, what'd you do?
I
We were
was
waiting for a fireman to come and rescue us, but a police officer came to the rescue.
mute, Joel. Mute. How's that? I mean, Councilmember Navarro, mute. Just one thing, and that is in talking to Dr. Joe and Rosa, and I had this discussion, and his hopes as well as ours, and I think everybody's. It's he reported out that he's hoping the FDA approval comes possibly by the end of the month, if not into the next month, and we're certainly hoping that comes, and that will be a piece of a puzzle too that helps us improve our vaccination rates. So it's the last piece that I just want to that we received this week that was positive. Thank you very much for allowing me to present with Rosa tonight as well, Mr. Mayor and members of council.
Absolutely. Thank you, Chief. Really appreciate it.
Thank you, Mayor, and thank you all, council, for the recommendations. We are working on myth busting. ASU has put out something, actually, Vice Mayor Mountain Park even said that for them, they want to put out TikToks regarding the myth busting for that age group. So in different type of platforms, I think that's important. But thank you so much for those recommendations. And lastly, just thank you for the support. I mean, we have a great city. I'm proud to be a resident and part of this team. So every day it is an honor. So thank you.
Thank you so much. Really appreciate it. Great presentation. All right, next up here, we have item 2B, which is the update on equal pay for equal work initiative. And I'm going to call upon Jonay Harrison, our Equity and Inclusion Manager.
Thank you so much. Good evening, Mr. Mayor and Council. What an exciting meeting you've had today, and I'm ready to jump right in there with you with equally exciting news. So happy to be here to celebrate our newest equal pay business partner, the Salt River Project, who completed the second pillar of our Equal Pay for Equal Work initiative, making them now the second largest equal pay business partner for the city. We're also here to announce the relaunch of our salary negotiation trainings with SRP. There are no council decisions that are necessary and no budgetary impact. Next slide, please. So as you see on this slide, Equal Pay for Equal Work was created in 2016 by the council, and it was created as an initiative which would help ensure pay equity based on gender, including devising a process to designate qualified businesses as partners committed to equal pay. This initiative really includes 4 pillars, though, of pay equity that simultaneously is in play. The one we're talking about today is the second, business designation, but we also have policy considerations, business education and outreach, as well as negotiation trainings, which we are talking about too. Next slide, please. For the second pillar of business designation, this initiative gives Tempe businesses who prove that they have less than an 8% gender pay gap the designation of being a City of Tempe Equal Pay Business Partner. Those that qualify receive this partner status and gives them the opportunity to use the logo that you see there on the left side of your screen on their websites, on their marketing materials, and in their facilities and hiring materials. Next slide, please. As you see on this screen, the applicants for this designation complete a rigorous self-assessment tool, then submit an online affidavit to the city to confirm their status as an equal pay partner. And I must say to the council that I worked with Matt Knotts of SRP, who worked diligently over months to complete this really tedious tool, which is important to know and to verify and create accountability. And he did a phenomenal job and really had the grit to go through that for SRP as a large employer. So a big recognition for Matt Knotts there. Next slide, please. The salary negotiation training, which is the 4th pillar that I mentioned, gives anyone who lives, works, or studies in Tempe the opportunity to learn the skills to negotiate salaries that truly reflect their value and their experience, skills, and education. So we're relaunching those at the end of this year, and each class will feature the same information, but it will take place either virtually or in person, depending on safety conditions, as we all follow the updates of Deputy City Manager Rosanne Chowsty and the team for COVID safety. Next slide, please. As I mentioned, we will launch in the late fall of this year, but most interesting and most exciting, we're also going to feature 4 female guest lectures from SRP, and those guest lecturers will present at the top of each of our training sessions. And as you see there, they're actually building on themes: courage, leadership, standing alone, and empowerment. And so they'll speak to each of those themes during the 4 salary negotiation trainings that we host together. If we can go to the next slide, I love this slide. This is Maria Neff, an engineering manager from SRP, and we asked SRP to talk about receiving this designation. They immediately identify two of their top leaders, the one that you see here, in diverse areas of SRP who were happy to speak about the designation. You see what she says here, equal pay enables women to thrive by being seen, heard, and valued in the workplace. But this quote actually stands on top of a history and a journey for Maria. And I'd like to share that with you tonight, Council. Maria has worked with SRP for 17 years. She started as an electrical engineer in the rotational engineering program and has held several engineering and analytical roles in transmission system planning, in resource planning and acquisitions, of the Energy Asset Management Division, as well as in policy procedures and standards. Her career progressed from engineer to senior engineer to principal engineer. That's so many acronyms, but most recently as the engineering manager of the PP&S team. She manages that team, is responsible for the development and maintenance of SRP's technical engineering standards for the design and construction of the power delivery system. So everything that we get in terms of power to our homes and to our businesses, there's a mighty woman that is helping on the engineering team that you see there. And so that is the meat behind that quote that we're so proud to show you tonight. Next slide, please. As I mentioned, we had two phenomenal SRP leaders, and Kristen Keim is the second one. Her quote says, "Women who perform the same duties as their male counterparts deserve to be compensated equally. Pay equity has given women the opportunity to thrive." Now, Kristen is a rock star. She's a field services liaison, but I have to tell you that what I saw about her and really representing pay equity for SRP really is the essence of what we're looking for in this initiative. Let me tell you a little bit more about that. She began her career at SRP in 2012. She started in the Water Contact Center as a customer service representative. And then in 2014, she bid into a field position as a zanjero, where she operated SRP's flood irrigation infrastructure. She measured water flow and delivered irrigation to residential and agricultural customers, as well as our city parks, our schools, and our golf courses. We owe her a lot. We owe Kristen a tremendous debt of gratitude. In 2020, she moved into her current role as field service liaison with water scheduling and field services, and she's now responsible for analyzing customer water order requests and developing the company's daily irrigation delivery schedules with a focus on maximum water conservation. So when we look at ourselves as a city that prides itself and has a council priority of sustainability, we know that we have a partner in SRP as well, specifically with Kristen. And I'm so excited to have women such as Kristen and Maria join us to talk about their journeys and what it means, especially for Kristen out in the field in a heavily and densely male populated field, to be a leader there. So can't wait to hear more about her. Next slide, please. Here we have congratulations, SRP. Before you with the Equal Pay Business Partner plaque is the Associate General Manager and Chief Human Resource Executive, Jerry Mingura, who you will hear from later this afternoon or this in this presentation, as well as a SIN02 Diversity, Equity, and Inclusion Manager. Next slide, please. As I said, we're excited to have Jerry Mingura with us this evening, accepting the award on behalf of Salt River Project. At the top of the year, we've got another leader here with us, Council. SRP named Jerry as its new Associate General Manager and Chief Human Resources Executive. Prior to that, she was a leader at On Semiconductor, APS, and Motorola. I love what Jerry said about joining the SRP team, which truly is the heartbeat of Tempe, our diversity, our equity, the importance of being an inclusive city. She said, and I quote, I value and share SRP's commitment to diversity and workforce development. Investing in the people of this community will ensure we keep building on a legacy of service and evolve to meet the needs of the future, end quote. That is so Tempe. And so I know the equal pay designation is in good hands with Jerry and SRP. So without further ado, I'd like to welcome to speak to you, Ms. Jerry Mingura.
Thank you, Jonay. Mayor Woods and members of the council, I am honored to join you today as you officially recognize SRP as a City of Tempe Equal Pay Business Partner. We applaud the city for stating loudly and clearly that equal pay for equal work is essential in building a truly diverse, equitable, and inclusive community. At SRP, we agree, and as one of Tempe's largest employers, we believe it is important to publicly show our support for this initiative and to demonstrate our longstanding commitment to pay equity. As part of that effort, we are continuously improving our programs to be more transparent, as well as providing a clear career path for professional growth. And we are continually reviewing qualifications and job levels to ensure our employees are receiving appropriate and competitive pay for the work that they are performing. We are looking forward to participating in Tempe's quarterly salary negotiation workshops, each of which will feature a female SRP employee, which Jonay mentioned. They will discuss their experiences in relation to the 4 pillars: courage, leadership, standing alone, and empowerment. These traits are critical to success. It takes courage to stand on your principles and to effectively advocate for yourself. And the workshops are designed to help empower women to achieve their goals. Our goal is for every SRP employee to feel valued and recognized for what they contribute, to feel like they belong, and to know that their voice is heard. We want to ensure a level playing field where every team member has an opportunity to grow and to succeed. The quotes you saw earlier from our 2 female employees capture the impact of delivering on that commitment. As your newest equal pay business partner, SRP believes the best way to support this initiative is to continue to lead by example. We believe that by embracing the richness of diverse ideas, backgrounds, and perspectives, creating an environment of respect, inclusion, and equity, including equal pay, you create value for your employees, the organization, and the community. Thank you.
Thank you so much, Jerry, and congratulations again to SRP for joining a group of illustrious equal pay business partners. We truly look forward to beginning the salary negotiation training series with you towards the end of the year. Our last slide for our Tempe 11 team, thank you very much for hosting. Our last slide was finally the website for any information. Anyone looking to learn more about the Equal Pay Business Partner designation or the initiative itself can go to tempe.gov/equal pay. Thank you so much, Mayor and Council, for the time and your consideration this afternoon.
Great. Thank you so much, Jonay. Really appreciate it. Any members of council? Let's see. I see Councilmember Arenado Savage.
Thank you, Mayor, so very much. And I know I just really want to speak up because I know that Councilmember QB's not here tonight. And this was something that her and I and Councilmember Shapira had an opportunity to work on many, many years ago. And just to see the evolution and to really see the drive and support that Jonay and her team has really given it to get to this level is just amazing. So thank you, SRP, and Jerry, if you're still there, thank you so much for doing the tedious work to being our very next committed business partner. That's so awesome. I very much appreciative of that. And I know my council colleague, Councilmember QB, would say exactly the same thing. And I think one of the things that we've learned is no business wants to have unequal pay. That is never the intent. And this just really does a self-reflection, a little bit of an audit to find time, see that there are some gaps. Not that we intended to get there, but it happens. And we found it in our own organization when we first sat down and did the work. So I just want to say thank you so much for taking the time, Jerry, to you and SRP. It's really great. Congratulations. And also to Jonay, for all the work that you continue to do within your team to help these businesses just really self-reflect and come to a great place. I'm super excited for the negotiating training. If people have not been to that, and even if you're not looking for a job, or you can learn so much. It's not necessarily about just negotiating, but it's about really understanding your value as an employee and how to be the best type of employee that you can, and to really understand I think where your value comes from. So they've been phenomenal. I'm so excited, and look forward to the opportunity to attend some of those from some of the SRP women. I know they're going to do awesome work and share really excellent messages. So with that, I just want to say thank you to everyone for bringing this program to this level. It's just really amazing, and I'm very, very grateful. So thank you, Mayor.
Thank you, Councilmember Arredondo Savage. Really appreciate it. And thank you as well for the work that you and Councilmember QB and Councilmember Shapira did on this program to bring this to fruition. And obviously, thank you, Jonay, and everyone on staff for really shepherding this through. This is really an incredible thing. And just once again, a show of the values and the innovation of who the city of Tempe and what the city of Tempe is all about. So I think this is really exciting. And I will second everything that Councilmember Arredondo Savage just said.
Thank you, Mayor and Council.
Absolutely. Any other council members, comments or questions? All right, seeing none. Thank you so much, Jonay, and thank you to SRP. I mean, obviously, congratulations on this designation. Obviously, it's such a valued partner in the community, and we just are so excited to continue working with you on so many things. And Jonay, once again, thank you so much for the presentation on all you're doing to continue shepherding this program.
Thank you.
Thank you, Councilmember Arredondo Savage and Mr. Mayor and the rest of council. It's our pleasure and our honor.
Thank you so much. Appreciate it. All right, next up item is 2C here, which is the 2021 solid waste rate study recommendation. And I'm going to go ahead and call upon our municipal utilities director, Terry Pecars.
Good afternoon, Mayor. Thank you. I'll share my screen. Just one second. Good afternoon, Mayor and Council. I'm Terry Pecars, Municipal Utilities Director. I'm here to update you and seek your observations regarding the 2021 solid waste rate study process and recommendations. No decision is necessary this afternoon regarding the study recommendations or any specific revenue adjustments. All public input received from the beginning of the rate study process through the end of July was compiled and provided in the packet for this meeting. After this presentation, a second month-long phase of public outreach will commence, during which time we will be gathering community input on the study recommendations and communicating potential impacts of proposed rate adjustments. Before council is asked to vote on the recommendations of the study at the October 14th regular council meeting, staff will provide a subsequent public involvement summary with all feedback received during phase 2 of our public outreach efforts. The 2021 solid waste rate study aligns with and supports these city council strategic priorities and performance measures. In addition, staff conducted the study in accordance with guidance received from council at the April 8th, 2021 City Council work study session and community input that was gathered from an initial public comment period from April 8th, 2021 to May 8th, 2021. The study identified that the gross revenue requirement to operate and maintain the utility for fiscal year 2021-2022 is $20.8 million. After subtracting miscellaneous offsets such as the sale of assets and interest earned on investments, the net revenue requirement for the utility is $19.7 million. Current rate revenue generates $19.4 million, meaning that an additional $300,000 is needed beginning in January 2022 to meet the revenue requirements of the utility. To achieve this revenue, an overall 3% revenue adjustment is required. A levelized rate increase of 3% per year over the next several years will maintain the minimum fund balance policy, which is the amount equal to 15% of annual operating revenue. Next year, while staff will not conduct a full cost of service analysis, the utility will complete a financial model update of the solid waste fund to determine if revenue adjustments are necessary. If necessary, staff will return to council in the form of a request for council action to seek approval of the inflationary solid waste rate increase. The rate increase would apply to each solid waste service provided by the utility. The latter years of the financial model and cost projections are more ambiguous and will be analyzed and refined during future rate studies to ensure that the utility is meeting fiscal year revenue requirements and fund balance policy. While the utility requires a 3% revenue increase overall, rate adjustments to specific classifications or service charges may be higher or lower depending on current revenue versus the actual cost to provide the service. Approximately 92% of residential solid waste customers receive the 96-gallon garbage and 96-gallon recycling service. This includes customers who share a 300-gallon garbage container deployed in an alley. 300-gallon garbage containers are shared by 3 customers, providing the equivalent of 96 gallons of disposal capacity per customer. This large group of customers will see a 75-cent increase on their monthly solid waste services bill. Collection and disposal costs were more precisely allocated in this year's financial model. The study determined that costs associated with collection were higher than previously modeled, and costs associated with disposal were lower. That is, the cost to collect garbage containers is the same, while the cost to dispose of the contents is different due to volumes and weights. Once these changes were incorporated into the financial model to more accurately align costs to the actual cost of providing service, one result was less difference between volume-based rates. Additionally, the cost allocation for green organics processing, alley maintenance, and uncontained garbage collection and disposal, while previously absorbed into the collection or disposal cost pool, were separated out and are now applied on a per container basis. As a result, while still less expensive than the 96-gallon or shared 300-gallon rate, customers being serviced with 48-gallon or 65-gallon garbage containers will see a greater increase in their monthly solid waste bill. This is another example of more accurate proportional cost allocation. The study also recommends a new monthly rate for an additional 96-gallon recycling container. Tempe's historical practice was to provide additional recycling containers at no additional cost. Changes to the national and worldwide recycling market and the resulting limited revenue from the sale of recycled materials necessitates that the utility recognize and account for the true cost of service to collect and process recycling material. Residential customers with additional containers will be notified of this change. The study analyzed and determined the amount each rate component contributes to the new recommended monthly charge to provide residential solid waste customers a clear understanding of the costs that make up their monthly solid waste bill. This image shows the contribution of each respective rate component for the 96-gallon or shared 300-gallon container size. As you can see, garbage collection and disposal and recycling collection and processing account for almost 70% of the overall rate, with uncontained garbage collection and disposal, green organics processing, and the alley maintenance program making up the remaining 30%. This graph compares Tempe's current and recommended residential monthly solid waste rate to other Valley municipalities. As represented in the dark blue horizontal bars, Tempe's is the second highest rate among the municipalities surveyed. Although Tempe's monthly charge ranks among the highest, residential solid waste customers receive additional services that residents of some other municipalities do not. These additional services reinforce our community's values and an investment in a safe, clean, and sustainable environment. This table highlights the additional solid waste services provided to Tempe residential solid waste customers compared to the municipalities listed in the previous monthly rate comparison graph. These are additional services beyond weekly garbage and commingled recycling collection. The respective cities are ordered from left to right based on their monthly residential solid waste rate from highest to lowest. As you can see in the Tempe column, the utility offers several services not offered by other municipalities, such as uncontained green organics collection, compost and inert processing, and alley maintenance funded and executed by the solid waste utility. Our programs and services offered by the utility reflect the values of our community, customers, and the Tempe City Council. The study evaluated operating costs associated with the compost yard operations versus revenue generated from gate rate fees and the sale of compost, and found that approximately $670,000 is unrecovered annually, which is subsidized by residential solid waste customers. Staff recommends ending pilot pricing and adopting a formal price structure that would allow for the wholesale and retail sale of compost based on the cost of service price and adjustable based on market conditions. Pricing would apply to internal customers such as community services and the Gulf Fund, as well as to the general public. This will allow the utility to maximize cost recovery. If it is the will of council, compost could also be discounted to Tempe residential solid waste customers, with any difference between revenue generated and annual operating costs being paid to the Solid Waste Enterprise Fund from the general fund. The city will continue to evaluate opportunities to partner with other municipalities or private entities to provide alternative means of delivering green organics processing to the community. The utility provides solid waste services to commercial customers in the form of side load, front load, and roll-off containers. The service delivery model for commercial services differs from that of residential service, since the utility operates in competition with private commercial service providers. The implications of a competitive commercial service market must be recognized in the development of commercial rates. The utility must aim to achieve overall direct cost recovery while being cognizant of its market position. The study did not recommend adjusting rates for front load garbage service, but did recommend decreasing the current multiple container discount. Based on a financial consultant's analysis and industry knowledge, it was determined that discounts offered in the city's current rate structure are higher than what is normally observed. As such, it is recommended that discounts be reduced by 5%, which will bring them in closer alignment with with industry standard practices. The utility also offers front load recycling service to commercial customers. Recycling curbside and front load containers and current rates are structured as a flat rate, regardless of the container size. The study recommends volume-based rates for front load container sizes that reflect the higher costs associated with larger containers. Chapter 28 of Tempe City Code pertains to solid waste. Coinciding with the study, staff has reviewed and is proposing revisions to Chapter 28, which was last revised in 2010. The revisions clarify and reinforce property owners and occupants' responsibility to maintain alleys, administrative processes related to licensing of private entities providing solid waste services within Tempe, the department's name change, and new and updated definitions. These revisions in part are in response to feedback received from customers during phase 1 of the rate study outreach efforts. Encouraging and providing opportunities for participation and input from the community served is an effective way of ensuring transparency. For the 2021 solid waste rate study, staff conducted an initial public outreach campaign to collect input to consider during the study. An example is several comments indicating that current service levels for alley maintenance and uncontained garbage and green organics collection is not meeting customer expectations. This input led to further financial and operational analysis and the inclusion of recommended additional resources in the study. The recommended rates reflect these increases. Today's presentation marks the beginning of a second month-long phase of public outreach. We will be seeking community input on the study recommendations, communicate potential impacts of the proposed rate adjustments, and seek feedback on proposed revisions to Chapter 28 of Tempe City Code. In October, Council will be asked to consider adoption of proposed solid waste rate adjustments. If adopted by Council, the new rates will become effective in January 2022. Before Council is asked to vote on the recommendations of the study at the October 14th regular Council meeting, staff will provide a subsequent public involvement summary with all feedback received during phase 2. Thank you for the opportunity to address you this afternoon and for your continued support. I'd be glad to answer any questions you have on the rate study process. Thank you.
Great. Thank you so much, Terry. Really appreciate it. Just one comment I wanted to make on the last slide you talked about regarding the alley maintenance. And so I just really appreciate you bringing that up during the conversation. It is one of the things that I regularly hear from residents about is the concern that there's a lot of sort of illegal dumping in the alleys, whether it's contractors cutting down palm fronds and other kinds of green waste and leaving it in alleys. People who are clearly kind of ignoring the bulk waste pickup schedule and putting out, a toilet from a remodel or an old couch or a mattress box spring. And then, and then the challenge obviously becomes that at the point that the resident, emails, the city or, reports it through Tempe 311, they're already frustrated that they're having to frankly do that. And so I'm just saying, not a criticism at all. I just really appreciate the fact that, in your conversations with your team, with residents, and a lot of what you've heard, you've heard exactly kind of, I think, what a lot of members of the council have been hearing too. So the fact that you're talking about proposing a change in service and a change in a rate increase, whatever, to obviously account for what it would take to actually provide that even higher level of service when it comes to alley maintenance, I think is a really, really smart and very, very astute move. So I really appreciate it. I want to make sure that this didn't come off as a criticism. Honestly, it's kudos, whatever, for listening to our residents and some of the concerns that they've raised regarding alley maintenance. So I just wanted to say thank you for that.
Thank you, Mayor.
Any other members of council, comments or questions for Terry? Councilmember Garland.
Hi, thank you very much, Terry. Thank you for the information. And I love how you are really doing the outreach to our community to get their input and get their ideas. And I read through some of the comments that people have made to you, and that they were very specific about some of the things that they were interested in regarding the waste situation. But one of the things I was just going to ask is, when you were doing this, when I was reading through some of the paperwork that you gave us, it said in there specifically that that the study calculated a sales price of $72 per cubic yard of compost. That was part of the rate study that you guys did, right?
That's correct.
Do you know what the market rate is for something like that? I don't even know where I could go to look to research that.
Yeah, thank you, council member. Yes. Actually, there's more detail on that in the actual rate study report and then in the memo as well. $72 per cubic yard is not competitive in the market. You would see probably in the $40 to $50 range in the market if you were to buy it at bulk quantities like that. So what we will be most likely proposing to council is to adopt rates that give us some flexibility in adjusting to market conditions, because we know that at that quantity we're not competitive, but we could be competitive, more competitive at smaller quantities. So that's correct. 72 is a very high number, but the consultant was asked to calculate what would it take to reach full cost recovery, and that's the number that they arrived at.
Okay, great, thank you. And then slide number 7 that you had up that showed the rates of City of Phoenix and Tempe and all the other cities that broke down all the services that we had. That was really great and a great visual for us to try to understand that it's not just a large higher rate, but there's a lot of other services that we do also. So that was a great slide to put in there and great information that you gave us. So thank you so much.
Thank you, council member.
Thank you, Councilmember Garland. Any other council members, any comments or questions for Terry? All right. Hearing none, once again, Terry, great presentation, and obviously just great job in terms of the what your team does each and every day, quite honestly, to keep this city a clean place, whatever. And secondly, just the community outreach portion that Councilmember Garland talked about. It's obviously so important and so critical with our residents. And so just really appreciate just your time and attention to that. And just because we know it does take time to really spend time talking to residents, going out and having public meetings, but it really does make the services even better. So just really appreciate what you're doing. And obviously, as you said before, if there are things that you need, I mean, I know a lot of our residents do talk about what they would like to see more when it comes to alley maintenance or other street maintenance. And this isn't a situation, just speaking for myself, where it's just a matter of saying, well, let's just sort of continue to do more with less. if there's a situation where to provide an even higher quality of service than what we already provide, you do need more when it comes to that. Please feel free to come back to the council, and we should absolutely have that conversation. But great presentation, great recommendations, and we look forward to seeing what you come back with when you have the public meetings.
Thank you, Mayor Woods. Thank you, council.
All right, thank you so much. Let's go to item 2D, which is the Tempe Police Department Narcan presentation. And I'm going to go ahead and call upon Sergeant Rob Ferraro, who's also the president of the Tempe Officers Association. Sergeant Ferraro.
Mayor Woods, thank you. Good evening, Mayor Woods and members of council. My name is Rob Ferraro, and I'm a sergeant with the Tempe Police Department. I appreciate the opportunity to appear before you, before all of you, to update you on the progress of our Tempe First Responder Opioid Recovery Project. I'll be providing a brief overview of the issue, our approach in addressing the problem, and our successes, and then finally a powerful video which encompasses the great work this project is accomplishing, as well as the teamwork of the Tempe PD and Tempe Fire Medical Rescue. There are no action items here for you to take, as this is informational only. So we've been through a lot, and we continue to endure many challenges as a country and in the state of Arizona, specific to opioid-related overdoses. Not only are we dealing with a worldwide pandemic, but we continue to struggle with the explosion of opioids and in particular fentanyl. Looking at Arizona, we see that between 2017 and 2020, DHS has reported nearly 6,600 deaths related to opioids. During that same time period, there were a suspected 47,503 overdoses. We saw an incredible year-over-year increase in the death rate, up 20% in 2017 compared to 2016, and 45% in 2018 to 2017. Tempe specific, during the same time period, we saw 544 suspected overdoses, resulting in 76 deaths, which translates to a death rate of 22.5 per 100,000, which is nearly double the national rate. So we wanted to be different. We could have very simply equipped our officers with Narcan, as many departments have across the country, but we wanted to take an innovative approach which addressed the monumental gaps in post-crisis navigational support. Our long-standing community behavioral health partner, Impact Suicide Prevention Center, which is located right here in Tempe, approached us, and together we collaborated and built a proposal which we think can have the potential of transforming how the police interacts with the community. Impact has been an incredible partner to the PD, providing mental health first aid trainings to 100% of our officers, as well as providing 24/7 crisis services through the county behavioral health system. This approach, in order to be effective, needed to be rooted in CIT, which is Crisis Intervention Team Training, meaning the answer always had to be yes when the cops called and requested help on their call. The grant opportunity came from SAMHSA, which is the Substance Abuse Mental Health Services Administration, and is valued at $2 million over 4 years. It would provide for one sworn FTE, who is our naloxone coordinator extraordinaire, Officer Dave Hansen, as well as 2 FTE positions for Impact, who would provide that peer support and post-crisis navigation. The grant would also provide for evaluation, which is being done by another longstanding partner, Arizona State University, in order to determine effectiveness of the overall program. Logistically, this is what it looks like. An officer or a firefighter administers Narcan in the field on a person, and if deemed successful during that administration, the person comes back to life. The officer, prior to clearing that call and leaving the scene, calls a dedicated hotline staffed by Impact 24/7. The officer very quickly relays 4 pieces of information: name, location, hospital being transported to, and any safety considerations. And that is it. That takes about 30 seconds in total. Again, very quick, little barriers, and no triaging. The officer then fills out a fillable digital field card, which alerts our Narcan coordinator, and that's the end of the officer's involvement. They move on to the next call. And this is where we move into the transformational piece. The impact hotline then immediately dispatches the on-duty or on-call crisis peer specialists and relays the 4 pieces of information provided by PD. Within 1 hour, the peer specialist responds and contacts the victim in an effort to build a connection. It's extremely important for this contact to have occurred within that 1 hour, which we refer to as the window of insight. It's this moment where the victim has reflected upon what occurred and they are most open to accepting of services. During this contact, the peer develops a rapport, provides Narcan to take home with them, and signs a release of information so that we can share information across agencies. This contact opens the door to a next day follow-up visit and up to 60 days of post-crisis navigation, which includes reentry support, transportation to appointments, and many other services. It really is a holistic wraparound approach, which has been proven to be effective. And these are some of the many examples of the service connections our peer support navigator will help the client with during that 60-day window. Outpatient treatment, residential treatment, intensive outpatient treatment, medically assisted treatment, inpatient hospitalization, transportation, housing, housing supports, employment support, and simple basic needs, food, benefits, AA, self-help, family supports, and even SMI service coordination. The successes have been absolutely incredible. In 17 months, Tempe police officers have saved 134 lives. Since this PowerPoint was created, which was about a week and a half ago, we've had 4 saves. So 134 lives. Our expectation and deliverable to SAMHSA was 45 in a 12-month period, and our actual was 101. Enrolled in supportive services currently is 119, a number which includes fire medical rescue referrals. Our 12-month deliverable was 75, and we eclipsed that, hitting 92. We have trained and equipped 506 people in how to administer Narcan, nearly 300 cops, and over 150 in the community. Lastly, we have distributed over 300 Narcan kits to survivors and family members. The more Narcan in the community, the better, so every chance we get to make that happen, we do. So in a few moments, I'm going to be showing you, it's about a 4-minute video where officers responded and saved the lives of 3 Tempe residents. But I just wanted to say that not only is this program having an incredible impact on our Tempe residents, but the impact it is having on our officers and morale has shown to be an unintended surprise. Administering Narcan and saving a life takes just a few moments of time, but the stories we share with our cops of those victims and how they are engaged in recovery resonates and is long lasting. The hope is that the program model can be replicated for many other types of calls for service, where the initial officer responds, determines the appropriate disposition, and then hands off or refers to a social service best equipped to deal with that post-crisis, which is essentially the bedrock of CIT. So this video is a call for service in Tempe where friends were recreationally using cocaine. They had no idea that cocaine had been cut with fentanyl until 2 of the friends experienced an overdose. Thankfully, one friend called 911 to where police officers and fire medical rescue began the response. Officers Soldo and Roy were on scene immediately and assessed the situation as an overdose. You'll be viewing both cameras at the same time, and at about 2 minutes in, the video is going to go silent. I'll provide a little bit more information at that time.
Here, can you show us where they are? Yeah, they're right there. Take us. Can I just take us? Please. Come here, please, please. Someone else that I'm with just started, like, okay. Both of them, please. Both of them, please. Both of them, please. Okay, okay. Get your Narcan. Back. Can you get the dog? Hey, can you get the dog? Get over here. Cuddy, get over here. Now, get over here. Oh my God, please. Sam. 4+23, we're both administering 2 doses of Narcan. It is going to be 2 meals down. Oh my God. 2 officers are assessing them right now, sir. Hey, bud. Wake up for me. Come on. Please. Wake up for me, bud. Okay, I don't need you. We don't need to talk to them. You're good. They're here. Wake up for me, bud. Come on, bud. 2, right? No, I got 2. Okay. You're good, bud. Come on. Come on. Ma'am, hey, you're okay, you're okay. The fire department's gonna come in, so can you put him away? Come on, bud. 23, we're both starting to see that. Come on. Wake up, bud. Hey. Come on. You got it, buddy. Come on. I just want the fire department's gonna come in, so if you can put him away, will you? What are their names? Okay. Okay.
So as officers continue to provide those chest compressions in an attempt to circulate the Narcan, fire medical rescues en route, as well as additional officers. So more windows are going to open up of responding officers, and they're going to find a third friend that's beginning an overdose as well.
Okay, what's going on? Okay. Where's the fire guy going to?
I have two other people in there who are sick and they're helping her, and she just started doing this.
Okay, let's get her laid out.
Oh my God.
Here, step back. Hey, miss. Hold on. Are all the fire guys inside?
A few of them are, yeah.
Hey, we got another one out front. Chick just started dropping. Alright.
Yeah.
Perfect. Just the guys I'm looking for.
I don't know. I need you to check for me. I don't know. Oh my God. This is not happening right now.
Here, miss, let's just go ahead and step back, okay?
Oh my God. This is not happening right now.
Okay.
So I share this video with you because the stories and the videos will always resonate better than words and data. This video provides an excellent example of how cool, calm, and collected our officers are in dealing with a crisis situation, and also how incredibly well our cops and firefighters work together. We really are blessed to have what is most likely the best relationship in the state among our first responders. And so with that, I'd be happy to field any questions that you might have, and I thank you for your time.
Thank you so much, Sergeant Ferraro. Great presentation. And seriously, I agree with you. The video it really does a huge service, whatever, when it comes to the jobs that our officers do each and every day, and even specifically with the Narcan saves. I mean, the data says something, but obviously watching that video, my heart was racing watching the video. So I'm just sitting here happening to take a look at this from my desk. And my heart's beating, but I can't imagine the officers that are actually on scene administering the Narcan. And that was the first thing that really struck me, was how calm and collected they were in terms of saving the lives of these 3 individuals. So obviously my hat's off to them and to the Tempe Police Department and the work with the Tempe Fire Medical Rescue for all of the exceptional work you do and all of those saves. I mean, just absolutely incredible. Let me look to our council here. Let me first start with Councilmember Arredondo Savage.
Yeah, thank you, Mayor. I mean, you said a lot right there, but Rob, I 100% agree that video is moving, to say the very least, and just a great appreciation to you. I know you were a big driver of trying to implement Narcan, one of those things, and thanks to Councilmember Navarro too, because I know, he really pushed, and one of the things that we've talked about in the coalition and the work of those young people in our community that unfortunately are doing things that we don't want them to do or shouldn't be doing. But it happens and it's there. And I know this last year and a half has been a big struggle for a lot of people, but just a big, huge appreciation to Tempe Fire Medical Rescue and Tempe PD and just the work that you guys are doing, but the way you're doing it together. I 100% agree with you, Rob, that I think we are a class act, collaborative effort that nobody can hold a candle to. And I mean, you're saving lives. We are not only just saving lives, but we're saving families. And that's what we do. And I just want to say thank you to all those officers and those first responders that get there first and for you to give us an opportunity to see it in action. Amazing. Thank you. Thank you, Mayor.
Thank you, Councilmember Arredondo Savage. Next up, let me go to Vice Mayor Keating.
Thank you very much, Mayor. My colleagues have said a lot of what I wanted to. Thank you, Rob, for your service, and the rest of the men and women of Tempe PD for what they do, and of course Tempe Fire Medical Rescue too plays a huge role in all this. I mean, obviously that video is something that is probably going to stay with anyone that sees it for a very long time. Just an average house, average people going through an event that could have potentially killed 3 people if not for the intervention of Tempe PD. So I'm wondering 2 things: is that something we can put out, through the department on social media, just to kind of highlight that cops are out there every day saving people's lives in the city of Tempe, one way or another. But just for me, that video I think really hits home that we need people willing to step up and serve the community in the way that Tempe Police does. And I think that's a great example of things that people don't think about when they think about policing in our community. So if it is possible, I don't know if it is or not. I mean, I guess this is a public meeting, but I'd like to see that video distributed more widely in our city, and maybe it'll change some perspectives. Secondly, just out of curiosity, was anyone in that video arrested or charged with a crime due to the drugs?
So two great questions. I'll answer the latter first. No. And so we have not made any arrests through the Good Samaritan law. If somebody calls 911 related to a drug overdose, we are not interested in making arrests for paraphernalia or things like that. We're wanting to save someone's life, try and get them the resources that they need, and that's it. And so we have not made, from all of these saves, 134 some saves, we have not made any arrests from individuals when we respond to these homes or any other location. So that's the first piece. Secondarily, yes, we actually just worked on a PSA. Tempe Fire had worked on a PSA separately, but for our grant reporting pieces, we had to develop a PSA. And so with the help of Greg and Jason Wolf, we are nearly completed with that public service announcement to include interviews with individuals who were saved by cops and telling their story of recovery, because that's an important piece as well. And so with that, being able to share these videos more widely, and this is one video of 134, and all of them are absolutely amazing. So my hope is that we can get this out there more broadly to show the good work that we're all doing. So thank you for those questions.
That's great to hear. I have a quick follow-up, thing as I want to say. I applaud you guys for, getting those videos out there and making them, trying to get them out in the public as much as we can. I love the fact that you're not arresting individuals when you come to these calls. You see in movies all the time when someone's overdosing and their friends and their buddies don't want to call the police, so they think they'll get in trouble. It's so important that information is out there. If this is happening to you, Tempe Police is not coming to try to jam you up, arrest you, take you to jail. We're more interested in saving lives. So I love the fact that you guys are taking that approach. I love the fact that you're going to be using these videos to try to get the word out there about not only the dangers of this laced cocaine, but the dangers of not taking action when someone is having an overdose. So great job to you and your department, and of course, all of Tempe Public Safety. I really appreciate this video and presentation. Thank you.
Thank you, Vice Mayor Keating. Next up, let's go to Councilmember Navarro.
Yeah, thank you, Mayor. Rob, thank you for coming and showing this video. He presented it to both Councilmember Garland and I at our meeting for looking at what we can do and how we can tackle these issues. And I have to say, when we first saw the video, and just like you guys said, powerful. It just says it all right then and there. You know, seeing what is being done. And we immediately wanted to get that out. So we did get it out. We had a little coffee talk about it and get that information going. So I think the staff and our council aides, I would love it if we are able to get this video or the PSA that's with the video and have each of us individually be able to post it via your personal or your city Twitter, Facebook accounts, whatever it may be, because I think, you know, individually we need to start making action on this. This is one step in providing the awareness of just what fentanyl and opioids and any drugs can do to anybody. The second thing is, which is really important, is the absolute coordination of administrating Narcan and how effective it is when you have an officer well trained in this, and you saw it in the video, cool, calm, collective, and then partnering with our Tempe Fire Medical Rescue Team, it is seamless. The partnership is seamless, and Robbie said it's one of those partnerships that a lot of people around the country with PD and fire truly do not have. And when you have that partnership, so many things absolutely go in the right direction. But the most important thing is the coordination with a community specialist. The follow-up is the most important thing off this video. The fact that you have 3 individuals taken to the hospital, and the fact that we're going to have a caseworker, so to speak, or a coordination with our healthcare specialists to get them help, to get them the awareness of any addiction or anything they need to start getting themselves in the right direction, getting cleaned up. You have no idea how important that is and how often I've seen that in my career when we have people with addiction and I have no resources to get them the help. We could take them to the hospital, but as soon as they're cleared, they're out with nobody really truly staying with them and tracking what they're doing and then doing a follow-up visit the next day. And you have no idea how important that is, because even if that person at the time does not even take that help, which, to be honest with you, when they're at that situation, they are very eager to try to do something about it. But even if they do fail, which often happens a lot, they know where to go to get that help again. And that's what's truly important here. And the other thing is the fact that we can provide transportation or try to get people to where they need to go. You have no idea how big that is, because there's so many people within our community that do not have the luxury of a car or even a bus pass. But to be able to do that and have those people really truly try to get that help, that is the real win in this whole thing. I tell you, out of 7 years of tackling this stuff, since I first went back to DC with the opioid committee and trying to get this thing going, it is so impressive to see where we're at today. In fact, I just looked up on the TV and there's a commercial about fentanyl and what it's done to a local teenager. We are getting the word out, and we got to continue on getting the word out, because this stuff we're seeing right now is truly making a difference. But I appreciate Rob coming in and showing this video. It's powerful stuff. It's just one step. We still need to go on. And I think Rob mentioned it, and I hope you guys understand, this is a foundation or a, how would I say, it is a template that not only can be used for drug addiction, but mental health and other things that affect our community, homelessness. This actually has a way to start tackling those other things that eventually we can take care of at the lowest level, and they do not become a PD level. And the thing is, PD is involved with taking care of this at the lowest level. So I have to say, I can't be more proud. I know that Councilmember Garland is excited about it. Should probably say a few words, because this truly coming out of our committee is something that we really need to broadcast. We really need to make sure that our residents know what's out there, because we do have emails every now and then. In fact, I've gotten some recently. Hey, what are you guys doing about opioids? If you're not, you must be under a rock or something, because in my opinion, and knowing other cities and where they're at, and everyone's trying to do the thing, we absolutely lead the way on opioids and addiction, and we're going to be leading the way in other things. So I'm very proud of what we're doing. Sorry to take so long, but Rob, this is outstanding, and I appreciate you and staff and the coordination with Tempe Fire Medical Rescue on this, and also our community specialists, the health coordinators, Care 7. You have no idea, guys, Care 7, how powerful they are. So thank you, guys.
Great. Thank you so much, Councilmember Navarro. Really appreciate it. Next up, Councilmember Garland.
Hi, thank you, Mayor. I just want to say I agree with everything that all of my council colleagues have said, and I remember when the first time that I saw this video, when it was presented at our Human Services and Community Safety Committee, I was speechless then, and I was a little speechless this time, and I found myself holding my breath while they were trying to administer the Narcan and to save those kids. And it's as frightening this time as it was before, but I think it's extremely impactful, and I think everybody is right that we need to get this. I think that video, get that out. Visuals work really well with youngsters, I think, and being able to actually see what has happened and what that Narcan has done to turn somebody around. I think, Rob, what you guys do is absolutely incredible. I think the program that you guys have set up is amazing. I really do love, like Councilmember Navarro just said, I like that window of insight that you had talked about, getting to people within an hour and then staying with them up to 60 days. I think that's really important for the follow-up, and obviously for the follow-up with the family also, to help the family understand what's going on. One of the things that you said is, you said the more Narcan in the community, the better. And it made me think of the Tempe Coalition that works to reduce underage drinking and drug use with youth. And I know that Councilmember Navarro and I are on that committee right now. They actually have a Narcan training that's free that anybody can go to. It's Thursday, August 19th between 11 and 12:30. And they will hand you Narcan spray after the training. So that's just another way that we're trying to get Narcan out into the community and try to save the lives as many people as that we can. So Rob, thank you so much for bringing this to the council, and I hope it was as impactful to everybody else as it was to just us here. So thank you so much for what you've done.
Excellent. Thank you, Councilmember Garland. Once again, Sergeant Ferraro, thank you so much. Really appreciate the presentation. Very powerful video. And as everyone talked about, just appreciate the work that the men and women of the Tempe Police Department do each and every day, whether it's on Narcan saves and just generally keeping our community safe. And of course, as you said, the collaboration with the Tempe Fire and Medical Rescue Team is truly second to none, not only in the state, but frankly, throughout the entire country. So once again, thank you for all the exceptional work that you and the men and women of the police department do, and appreciate the great presentation tonight. Thank you.
Thank you. Thank you, Mr. Mayor. And thank you, all the council members, for the comments and questions. We really appreciate it. Thank you. Have a good night.
Thank you, Sergeant. Okay, next up here, item number 2E, which is the American Rescue Plan funding update. And I believe I'm going to go ahead and call up our Deputy City Manager, Ken Jones, and our Budget Director, Mark Day.
Thank you, Mr. Mayor. I'm Ken Jones, Deputy City Manager, and Mark and I have a brief presentation for you tonight. We have two objectives. One is to give you the update on the American Rescue Plan Act funds, also known as ARPA. We were in front of you in March telling you that we knew how much we were going to receive, but that rules were still being developed in terms of what the funding could be used for and in what manner it needed to be spent, and in the time frame. So we have a little bit of an update for you today. Mark will give you most of that information. We have two objectives. One is to give you that update so you're more familiar with where we are on the ARPA funds. And then the second is just to discuss briefly the City Council's budget priorities and try to align these funds with the priorities that you've given us in the past and some of the changes that we believe have taken place. So there's a lot of information in your packet. And Mark will go over the ARPA funds first, and then I'll get back to you in a little bit and talk about how we align that with the budget. So Mark, if you could introduce yourself and kick it off.
Thanks, Ken. Good afternoon, Mayor and Council. Mark Day, Municipal Budget Director. So today's discussion about the potential budget strategies for the use of the American Rescue Plan Act funds ties the City Council's strategic priority to strong community connections, and then performance measure 2.15, feeling invited to participate in city decisions. So a little background information on the America Rescue Plan Act. So the acronym it goes by is ARPA. So the ARPA was passed in March of 2021 and provides $130 billion to support cities and towns in responding to the impacts of COVID-19. The City of Tempe portion is $45.99 million. We've already received one half of that amount, with the second half anticipated in May of 2022. The Department of Treasury has issued initial guidance on the eligible uses of the funds, with final guidance later this year, although we don't anticipate substantial changes in the rules. So we have been working with national and local organizations for assistance in interpreting the rules and reporting requirements. So there's four broad categories of eligible uses, so I'll quickly go through those. The first is to respond to the public health emergency or its negative impacts, including assistance to households, small businesses, and nonprofits, or aid to impacted industries such as tourism and hospitality. The second eligible use of the funds is premium pay for eligible workers. The third eligible use is for the provision of government services to the extent of revenue loss due to the economic impact of COVID-19. So this category appears to be the least onerous option for spending the ARPA funds, because we would receive funds as replacement of lost revenue with few restrictions on its use. Revenue loss calculations are required to be performed for each calendar year ending, so 12/30/20, the past calendar year, 21, 22, and 23. So we have 4 years we're eligible to do calculations on revenue loss. So based on our revenue growth models, it appears as much as 40 million of the 46 million may qualify under this category. So for the first revenue loss calculation at 12/31/20, it is anticipated that 21 million in revenue loss can be realized. And then the last category you see there is necessary investments in water, sewer, and broadband infrastructure. So just a few more points about the ARPA fund restrictions. There is a time restriction. Eligible costs must be incurred or obligated by 12/31/24 and spent by 12/31/26. So in the bill, it does say that if the funds are not spent, they must be returned to the Treasury. And just some overall restrictions that they put in place about the funds. You're not allowed to use the funds to pay pension obligations, reduce taxes or delay a tax increase, pay down debt service, so principal and interest on debt, or to build up your fund reserves. So to go back a little bit in time here, at the March 18th work study session, Council identified CIP projects for additional funding using the ARPA monies. And then at the April 8th work study session, we presented the final recommended 5-year CIP that included the addition of the ARPA funding. So listed on the slide here are the CIP projects that received additional appropriation utilizing the 46 million in ARPA funds, with one exception, and that's the Roosevelt Storm Drain Project, as this project could not be accelerated due to some restrictions as far as coordination with the City of Scottsdale and the Maricopa County Flood Control District. So they are contributing to that project and they could not move that project up. So the specific dollar amounts and timing of the additional funding is listed in the memo that was part of today's agenda material.
So Mayor and Council, what we need to speak about a little bit is to make sure that we understand the priorities of the City Council. So as Mark stated, the 12 or so projects that you identified for ARPA funding when we were in front of you in March, we believe that some adjustments have been made. And a couple of those are on the screen here. We know, based on recent council conversations, that we want to move the priest yard and the traffic ops yard facility quickly. And in the CIP, we had that budgeted for only 27.5 million, and that was in year 5. So clearly, we're going to have to make some adjustments in order to move those yards in the next couple years. So that's going to be an adjustment to our CIP that we're going to have to make. The acquisition of the police impound lot for the cars that the police department stores, that's part of moving the priest yard. Those are currently, the majority of those are currently being stored at the priest lot. So acquiring that property goes along with the movement of those 2 yards. The other thing is, in the CIP that we had shown you in March, we had assumed the construction acquisition of non-congregate shelter in year 5. You've already provided enough input for us to understand that that has been accelerated. As a matter of fact, you just acted to, in year 1, purchase a property for about $3.3 million to start moving that forward. So these are some adjustments to those priorities. You don't have to do anything tonight. If we go to the next slide, I'll give you an example of what we're going to be looking at. So we know this is just a sample scenario. These numbers are made up. But if it costs $2.5 million more than we had budgeted to move the PD impound lot, and the priest yard and traffic ops yard could be moved at the same time with the same plans, and we recognize the benefits of doing that all at once, the original estimate I think we got from makers was, I want to say 70 or 80 million dollars to move those two, but that was on a one-off basis where we weren't taking them together. So Marilyn and her team are working on getting updated estimates for what the cost will be. But in this scenario, let's assume that would cost $60 million. We know that solid waste is a big portion of the priest yard, and that enterprise fund would absorb a lot of that. So in this scenario, we'll say 25 million. So that means we need $37.5 million to fund those moves. We currently, as I stated earlier, only have $27.5 million. So we would require a $10 million adjustment in that scenario. So we're waiting. These variables, we don't know the answers yet. We think we have a piece of property picked out for the PD impound lot. And we also have, like I said, Marilyn working with the makers folks to get updated estimates on the priest yard and traffic ops yard. So we will be back to you in the future to talk about what adjustments might be necessary. We're just letting you know that we're working behind the scenes to get these estimates so that we can come back to you. And the timing of that, Mark, if you go to the next slide, we anticipate that by the beginning of October, we'll have pretty good estimates for the PD impound lot and also the makers' updated estimates for the movement of those lots. We anticipate that Mark and his team will be able to look at what ARPA funding can be used just to reinstate the lost revenue that we recognize. And then we'll come back to you. We're proposing here probably near the end of November, and then we might have some CIP adjustments that are necessary, but you don't have to do anything tonight. So we just want to confirm, and I'm almost positive that you've already stated this, which is we want to move those 2 yard sites almost immediately within the next 2 or 3 years, not in year 5. And that the traffic ops and the priest yard would include the movement of the police vehicles. And we also believe that the non-congregate shelter has already been acted on. So that's a priority that you've already, in essence, stated. So we're just looking for any input you have tonight on this strategy. We don't need any input on adjustments to the budget at this point. But if there's anything in this strategy that concerns you, you need to let us know now. We believe that the priorities that you've already stated, that we will be able to take down our entire ARPA allocation and spend it appropriately. There are obviously other ways it could be spent, but we can't go back and forth and back and forth. We're making budget plans now. So if you have any priorities other than those you've previously stated, this would be a good time to maybe give us those priorities. Anything else, Mark?
Nope, that sounds good. Thank you.
Thank you, Mayor.
Sounds good. Thank you, Ken. Thank you, Mark. Really appreciate it. I'll look to the council now to see any comments or questions. All right, seeing none, I personally will just say, I'm comfortable with the direction that you've both laid out tonight. I think from my perspective, the council's priorities are accurately reflected in it in terms of what we're looking to have moved up and what your strategy is in terms of achieving those, and the timelines also in terms of October 1st for having some probably more concrete numbers in some of those moves, I mean, also makes complete sense to me. So I don't have any issues or concerns. I think it all looks great. I think it's a great presentation and does a great job of informing our residents some of the things that both council and staff are looking to accomplish in the next 12 to 18 months. Council, any further comments?
I agree with you, Mayor. Thank you. Nicely said.
I agree with you, Mayor.
All right. Wonderful. Ken, Mark,
Okay.
can I think you always hold the record for like the shortest Q&A sessions from council. So I think you're setting some kind of City of Tempe record. So
I think the council members are still starting to recover from some of the past presentations they saw tonight. So thank you.
thank you, Ken. Really appreciate it. Thank you, Mark, as well.
Thank you, Mayor and Council.
All right, next up here, item 2F, future agenda items. Council members may request that an agenda item be added to a future issue review session. And in accordance with the Arizona open meeting law, there should be no discussion on the item other than to clarify the request. Do any members of council have any future agenda items they'd like to put forward right now? All right, hearing none. The next item on the agenda is the call to the audience for committee of the whole items. Speakers will have up to 3 minutes to address the city council. Madam Clerk, do we have any additional speaker or comment cards received from the public wishing to address the council this evening?
No comment received for committee of the whole, Mayor.
All right, thank you so much. I'm going to move forward then with item number 4, committee of the whole items. First one is 4A, items ready for city council direction or status update. We've got none this evening. Next up, item 4B, council committees in progress. We kind of go updates as needed here. Is there any council member who'd like to provide an update regarding the following council committees? Human Services and Community Safety, Workforce Readiness and Economic Vitality, or Sustainable and Livable Communities? Any council members have anything they'd like to add? Let's see, Councilmember Garland.
I don't have anything to add, but I just want to say that our Human Services and Community Safety meeting is on August 27th at noon. I just want to remind people to come and join us.
Sounds good. Thank you, Councilmember Garland. Anyone else? Any comments, questions, additions? All right, hearing none, I'll go ahead and close that portion of the agenda. Next up, item number 5, mayor's announcements. I don't have any announcements this evening. Mr. City Manager, any announcements?
Thank you, Mr. Mayor, members of council. We've had 2 individuals recently retire here from the city of Tempe or are about to that I want to recognize. They are both people who do not in any way, shape, or form seek the spotlight, but I'm going to take a matter of personal privilege here and personally congratulate on their long years of service to the city of Tempe, Public Information Officer Amanda Nelson for her many years of service. She's retiring. And also Prosecutor Andrew Davidson, who way back in the early 90s was a student at ASU Law School at the same time that I was, and we were both starting out in the city attorney's office and overlap there for many years, and who I have just very high regard for, as well as for Amanda. I wish Andrew and Amanda all the best. Thank you.
Thank you, Mr. City Manager. Really appreciate it. And also, I know I could probably say this, I rarely do, but I'm sure on behalf of the entire council as well, we want to wish Amanda and Andrew very happy retirements. They've both put in lengthy careers here at the city of Tempe and done exceptional work, and they will most definitely be missed, but we wish them the best in their next adventures. Let's see, next up here, item number 6, next meeting date. Madam Clerk, do we have one? Are we still kind of on a to be determined status?
Last I heard, Mayor, we were looking at August 30th, which is a Monday, to reschedule that September meeting that had a conflict. So I don't have confirmation, but that's what I have pending.
Sounds good. Obviously, the council and staff, we can come together and figure out when that will be, and we will post it in accordance with the Arizona open meeting law. So no need for any decision this evening. With that said, I'm going to go ahead and close the discussion and adjourn the meeting at 6:34 p.m. Thank you so much, everyone, for joining us. Have a great night. Have a great weekend. Council, we have a quick executive session, so if we could just switch over to the next virtual room.